So hello, everyone. Thank you for being here with me on Karunamai Sita webinar with Dr. Thrivikraman from Kerala. He is an Ayurvedic doctor and he has a bachelor's in Ayurvedic medical sciences. And he has a considerable amount of experience in Ayurvedic clinical practice as well as research and development in Ayurveda. He worked for one of the well-renowned companies of Ayurveda called Kottakkal Ayurvedasram. It's globally renowned and has branches everywhere. And Dr. Thrivikraman worked even in their Muscat branch. And he always wanted to have his own organization, but he first tried to gain considerable amount of experience in his own life in Ayurveda through his clinical practice and R&D work. And then he opened his own hospital in South India called as Swetranya Ayurveda. Just one moment, I can't fully recall the whole name. It's a hospital in South India, Swetranya, yeah. And he's the chief physician there, and he is doing Panchakarma treatment, offering Panchakarma treatment for patients there. However, it does not look like an hospital. There is his YouTube video, which I will share in the chat here, where you can see how his hospital looks. His hospital is basically like a divine ashram. It has everything. Like, you don't just get a treatment of Panchakarma, of Ayurveda, of herbs, of good vegetarian like food, but it is also the atmosphere that you get there is healing in itself. It's very relaxing. He himself starts off his day with prayers and yoga, and he takes care of his patients there. And it's a full, complete package that he offers there. It's not just a treatment, but like food and yoga and everything. He makes sure that people are recovering in every way on a very holistic level, because that is how people heal long time. So I welcome him to this webinar to share with us some wisdom today on Ayurveda. And he will guide us through some of the principles of Ayurveda today and how Ayurveda works. And then after that, people can ask him questions. So thank you so much, Dr. Thrivikraman, for being here with us. And I will now hand you the mic so you can start the webinar. Thank you so much.
Thank you, Gauri, for inviting me for this presentation. Can you share the screen, please? Because I'm not able to share it.
Share screen, like
the host disable participant screen sharing. That's what the message.
I will just try to see multiple participants can share. Can you share now?
Yeah, let's see. Screen share. Is it visible now, the screen? Hello.
Screen is visible, Dr. Raman. Yes, it is visible.
Oh, okay, fine. Okay, good morning, everybody. I'm trying to explain the basic principles of Ayurveda. I will try to explain it in a simple form as much as possible, because this is not something which we can make understand that easily, because most of the terms are in Sanskrit, and many of the things is it's actually we have to experience than experimenting. So let us see how much it will be helping you to understand what the system is. We will start with the definition of Ayurveda. The first thing is the sloka, what Ayurveda is. And the meaning is, it is a science which explains about what are all the things which is beneficial in your life, and what are all the things which are harmful, which damages your body, mind, and what are all the things which give happiness and unhappiness or suffering, and what is beneficial for getting a long life, and which is harmful for that. And actually the science which explains about the lifespan, that is called Ayurveda. So you can see one thing, that nowhere it is explained that it is a system which is to treat a disease. So that means this is something which deals with everything from birth to death. Ayurveda explains how you should get a healthy baby, how you have to get prepared for getting a healthy baby, because there are certain regimens which is explained, certain medicines which is explained to have a good ovum and a good sperm, and even how you have to do the contact, and after getting conceived also what are all the things which you have to do in every month for the proper growth of the fetus, and after the delivery what you have to do. And there are medicines which is recommended for a normal delivery, and usually less complicated delivery. And what are all the things which you have to do after the delivery, because first you have to clean the uterus with proper medicines, then after that you have to take medicines to repair the body after carrying the baby for the 10 months. Then again another set of treatment which we have to do for the rejuvenation of the body. Again, if you plan for another body, your body should be get fit for that. And at the same time, there are treatments for the baby also. Each month there are certain medicines which we have to give for the baby. That is for the general well-being of the baby, even the brain development. And what are all the situations which we usually come across during our lifetime, that also Ayurveda explains how you have to behave with the society, how you have to deal with people. There are so many things which is explained. So that way I can say this is something, it's a way of life rather than just a system which treats certain diseases. Even the definition of Ayurveda, you can find the same thing. Ayurveda is the combination of two words, Ayu and Veda. The meaning of Veda is knowledge or science, and the word meaning of Ayurveda. Veda is knowledge and science, Ayu is life. So it is the Ayurveda means the science of life. So as I explained, everything which we are coming across in a life, Ayurveda is dealing with everything. And there are two main objectives for Ayurveda. One is to maintain the health of a healthy person and cure the health issues of a diseased person. Ayurveda gives too much importance in maintaining the health. Even there are different portions in Ayurveda, certain things which deals with the principles, certain things deals with some other factors. So where the first few chapters in Ayurveda that focuses on how to become a healthy person. So there are so many things which is explained later on. I will be just giving a general idea about that. Then how we have to treat a disease also. That also we are going to discuss in the later slides. And there are 8 branches also in Ayurveda. Kaya Chikitsa we call for general medicine, Bala Chikitsa for pediatrics, Graha Chikitsa for psychiatry, Urdhvanga, that is in and above the shoulder level, that is the ENT, in which even the eye diseases are also included. Then Shalyatantra is the surgery. You can see Sushruta is the father of surgery who developed the surgical equipments and all in those days. The same surgical equipments are still the modern doctors are using. Many of the surgical equipments are the modern doctors are using still. Then the Damshra Chikitsa is the toxicology, Jara is the geriatrics, and Vrishya Chikitsa is rejuvenation. Now we start with the basic principles. This I will try to explain as much as possible, because this is certain things which we cannot show you. This is what we have, but we have to think and you have to contemplate on that to understand what it is. So actually Ayurveda says each and everything in the whole universe is composed of 5 types of elements. We call it as Panchamahabhutas. That is Prithvi, that is the solid portion. We call it as earth. Then Jala is the water component. Fire is the Agni, we call it Tejas. And Vayu is the air, and Akasha is the vacuum. And when you see how it related with the thing, Prithvi, you can see the forms of the shape, something. Even the sensory perception also has some role with this Panchamahabhutas. If there is a Prithvi component, then usually you will get the sense of smell. And when it goes to the At Dhatu, that is the water portion, there it is related with the taste, and that gives the liquidity, moisture in the body, lubrication and all. Tejas is something which we called the heat energy in the body, any transformation within the body which happens through Tejas. And vision is the sensory perception related with the fire element. Then Vayu is the vital force. Each and everything, any movement within the body will be happening with the presence of Vayu, and the sense of touch is related with this component. And Akasha is the space which is required for everything. So it is the minor pore through which everything travels from one end to another end. And the auditory function is related with Akasha. And now this Panchamahabhutas, or the 5 elements, are present in our body, both in minute and gross form. In minute form, we call it is the 3 doshas, Vata, Pitta, and Kapha. You see, Akasha is the very minute component, then slightly larger form is Vayu, then Agni, then Jala, and then Prithvi. Akasha is you cannot you can just hear the sound from the Akasha, but Vayu even you can touch and you can have you can perceive the sound. When it comes to Agni, you can see that, but you cannot taste or you cannot smell it. And when it comes to Jala, you can taste it, but there is no smell. If there is a smell for some liquid, means there should be some Prithvi particles in that. And when it comes to Prithvi, all the 5 sensory perception, it is possible with the Prithvi. So Prithvi is the most gross form and Akasha is the minute form. And when Akasha and Vayu combines together, that helps for the formation of Vata. So Vata is the most minute component, most minute dosha or dhatu in the body that controls the overall function of our body. Then comes the Pitta. Pitta is combined with Agni and little of Jala, so that is slightly in the gross form. And then comes Kapha, that is Jala and Prithvi, that is the most solid form, not the gross compared to Vata, that is more gross in nature. So when you say this, Vata is composed of the most minute things, Kapha is composed of the larger components. So the Vata can move into the minute particles in the body, minute aspects of the body, where kapha has some limitation. That is why Ayurveda explains mainly there are 80 types of diseases that is developed because of the vitiation of vata. So that is happening because of the minute aspect of this dosha. It is capable of entering into the minute particles of the body where it can create a disease. And while coming into the pitta, around 40 diseases are explained, which is developed because of the vitiation of pitta. And kapha, just 20 diseases are because of the vitiation of kapha. So this is one of the basic things which we have to keep in mind in relation with the doshas. Now we will see more about three doshas. Another thing, the gross form, the minute form is the formation of three doshas, and the gross form is the different tissues in the body like skin, blood, muscles, bones, etc. Now our body is composed of mainly three things. As we call it is three doshas, vata, pitta, and kapha, and dhatus we call that is there are 7 types of tissue. I'm going to explain about that later. And malas are the 3 excretory products. Now we will come to the 3 dosha. I told you vata, pitta, and kapha are the 3 doshas in the body, and each dosha has its own properties. Properties mean this is the nature of these doshas. That is, vata is something which is dry in nature, which is very light. It's not heavy. It is cold in nature. It is rough. It's very minute and moving. So you can see as we explain the components of the formation of vata, that is the most minute form of the things. That is why all these properties it has already got. Then the next one is pitta. Pitta is slightly hot in nature. It's oily and fast acting. It's also very light, and it is putrid in odor and it's liquid in nature. When it comes to kapha, it is oily, it is heavy. This is also cold in nature. The action is slow. It is finely sticky and hard. So this is the nature of the 3 doshas. Like if somebody is having dryness in the skin, you can understand that there is a vitiation of vata in that. If the body is becoming light, becoming lean, then that is because of the presence of vata. If somebody is having an inflammation, if body is more hot, there is more burning sensation, that is because of the vitiation of the pitta. In normal case, the normal body temperature, the pitta will maintain. In normal function, the normal movements of the body, the vata will maintain. And kapha also will maintain the steadiness and stability of the body in its normal form. So this is just to understand, this is the nature of the 3 doshas. When something, due to some reason, if there is a vitiation, if there is an aggravation of any of these doshas, that will show the signs and symptoms related with these qualities of these 3 doshas. Then the normal functions of vata. I told you all the movements are happening because of the presence of vata. Our general energy, breathing, then the elimination of the waste product, transportation of the nutrients, all these movements, which is related with movements, that is related with vata. And again, vata is of 5 types, and each types of vata has its own properties. I'm not going to that deep now. General information I'm trying to give you. Now, regarding the functions of pitta, we have seen that fire is the main component in the formation of pitta with little water component. So anything which is related with heat, that is related with pitta. So digestion usually happens with the digestive fire. So we relate with pitta, and the body temperature is the normal body temperature is because of pitta. And our vision is also related with pitta. Even the complexion of your skin is related with pitta. So these are all the normal functions. When pitta aggravates, it creates so many other disturbances that also we will see in the next slides. Then the functions of kapha, we have seen that it's formed because of the gross form, both the water and earth component. So it gives more stability and oily nature, and it binds the whole joints and organs, gives the stability and strength of the body. Then if there is a vitiation happens in vata, pitta, and kapha, what will be the signs of that? Vata, I told you that it can in its normal form, when it is in the balanced state, That will give you the optimum health. And when it is vitiated, that can create that much destruction in the body also, because it can enter that minute aspect of your body. So usually weight loss, cellular destruction happens because of the vitiation of vata. The darkish rin, some sort of any sort of tremor, whether it is related with some disease or some other condition, then the flatulence, most of this gas problem, constipation, general weakness, insomnia, less sleep, poor sensory perception, giddiness, all these things can happen when the vata is vitiated. There are more explanations are there about the vitiation of vata, but just to give an overall idea, I am giving you some of the symptoms which is explained, the important symptoms which is explained in related with vata vitiation. The next thing is related with kapha. When pitta is more, then your feces, your urine, your eye will be yellow in color. Even your skin also, this is quite visible in jaundice type diseases where it is a pitta vitiated condition. So usually we will treat that patient with pitta pacifying drugs and diet. Then patient will have more appetite and thirst if the pitta is aggravated. There will be burning sensation. Again, insomnia is another symptom in the vitiation of pitta, and inflammation. Any heat related inflammatory changes, temperature based things are related with pitta. Then the kapha vitiation happens. When happens, it causes poor digestion. There will be chest congestion, heaviness of the body, weakness. The patient himself will feel that he is not fresh. Always he'll have a feeling of heaviness, and he'll be not in, just like when we get a cold or when there is a slight fever, how we feel. That is most of the time it will be because of the kapha vitiation. And doshas have its own areas in our body. The vata is more stronger, or the main seat of vata is below the navel region. That is the large intestine. That is why in the treatment of vata also, enema is one of the main treatment. I'm going to explain in short what is enema and other panchakarmas. So there I will explain a little bit more about it. Then pitta, the seat is between the heart and navel region. That is the small intestine area where the maximum digestion happens. So that is the seat of pitta. And when there is a vitiation of pitta, we have to administer purgation. We have to give drugs for creating loose motion. Then the next one is kapha. Then the seat is in and above the heart level. So the seat is mainly the stomach. So the easiest way to take out the toxins is through the mouth. So that is why we will give induced vomiting drugs for that. And related with a day, night, age, food, and also the vata, pitta, and kapha will be stronger. In a day, in the evening time, vata is stronger. Mid-time, pitta will be stronger, and early morning, kapha will be stronger. This is very relevant when we interact with patients, because in some cases they will say they will get more problem in the early morning. That means there is a presence of kapha in that. If it aggravates in the noon time or at midnight, then there is chance for a pitta predominance, and in the evening means there is a vata predominance. The same thing happens in the night time also. The late night is the time for vata, midnight is for pitta, and the early night time is the kapha period. You can see in some acidity cases and all, the patients will have more of this problem at midnight. So that is the indication the pitta is aggravating even in the midnight. And related with age also, more of this cellular destruction and degeneration of the body is happening in the old age. So that is the time for vata predominant. The younger age, that is the pitta period, and the childhood time is the kapha. And one more thing is there, kapha is always held for the cellular regeneration. The construction is happening with kapha, and the maintenance of your body is happening with pitta, and the destruction of the cell is happening with vata. So here you can see the predominance of kapha in childhood means for children, they will have more cellular multiplication than cellular destruction. That is why the child is growing. In the youth, for youth, it is almost same. And in the older age, the cellular destruction will be more, where the cellular, the production of the cell will be comparatively less. So that also by age, there is a relation between these three doshas. And in the food also, when you eat food, that time it is the gastric phase where the kapha is predominant. Then when it moved to the small intestine, their pitta is predominant. And in the colonic phase, vata is predominant. So this is the relation of three doshas with a day, night, age, and food. So when these three doshas, I have told you what are all the properties of the three doshas and what are all the normal functions of the three doshas. So in normal balanced state, all the bodily functions will be maintained with these three doshas, and that gives an optimum health. And if there is an imbalance in this three doshas, that will create disease. Now, I told you in the beginning that the body is composed of three doshas and dhadus. Dhadus are the 7 types of tissues by which the body is made up of. So it is called rasa, rakta, mamsa, medas, asthi, majja, and shukra. These are the 7 types of tissues. Rasa means it is the first nutrient which is coming up after the initial digestion. Even when you feel thirsty, if you just drink a glass of water, you feel comfortable. So that thing is, we call it is the rasa dhatu. And in the gross representation, you can say that it has relation with your skin. Then the next is rakta, is the blood tissues. Then comes mamsa, the flesh. Then medas is fat tissues in the body. Asthi is bone. Majja is bone marrow. And shukra is either sperm or ovum. And each of these 7 dhadus, the 7 tissues, have its own properties. The first one, rasa, is the prenanam, the satisfaction. I told you, when you drink a glass of water, you feel comfortable, you are satisfied. So that is the first thing which is related with rasa dhatu. That is the effect of rasa dhatu. The next one is rakta, that is jivanam. The life is based on the blood. Then the flesh which covers your body, that is why the property is lepanam. Then the fat is something which gives lubrication to your body. Bones which give shape your body. And bone marrow is something filled up in the bones. So that fills the bones. The sperm or ovum are essential for garbholpadanam. That is for pregnancy. So these are the 7 types of tissues, and that is why these 7 types of tissue is explained in the next, how it is related with the bodily functions. Now we will see how each dhatus or each types of tissues are developing when we have food. The digestion begins with the rasa agni, we call it. For the digestion, Ayurveda explains one thing, the common digestive fire which we can see, that is help for the digestion. But then to transform from one level to the next level of tissue, there should be a digestive fire in between. For example, when you take food, the first formation should be rasa dhatu. So there should be a rasa agni which helps the food to absorb for the rasa dhatu at that level. Then the rasa agni will help for the rakta to absorb what are the nutrients which is needed for the rakta dhatu. Then the rakta agni helps to transform this food to reach the mamsa dhatu, to develop the muscle tissues. Then the mamsa agni will help that nutrients to reach the medo dhatu or fat tissue. Then the medo agni helps for the formation of the asti dhatu. Then the asti agni helps for the formation of bone marrow. And the majja dhatu helps for the formation of shukra dhatu. And after the shukra dhatu, there is another agni that helps to generate the ojas. Ojas is the ultimate essence of your nutrient, which keeps your body mentally and physically healthy. Even the brain function will be at the optimum level when the ojas is formed properly. That is why Ayurveda has given limitation in the sexual intercourse, because Ayurveda explains about three pillars in your life. One is the food, the second one is the sleep, and the third one is the sexual activity. So the food, which I'm going to say in few slides, and the second thing is the sleep. Sleep, you should sleep 6 to 8 hours at night, not in daytime. And otherwise, that also will create adverse effect for the body. Then the third one is the sexual activities. So Ayurveda says, according to the season, if it is in summer season, you have to do sexual contacts once in 2 weeks. If it is in rainy season, you can have once in a week. And if it is in cold climate, according to your physical health, you can plan how many times you are supposed to. But the ultimate aim of a sexual activity is to get a next child. That is what the acharyas has thought of the sexual activity. But nowadays, in the modern side, it has become an aspect of pleasure rather than getting a child. But in olden days, they were having more of that spirituality. So for them, they focus on that plane rather than the other enjoyment. So they were having more of this ojas, and that ojas and their meditation and yoga practices were helping them to understand what is happening in and around the whole universe. That is why they were able to find out these types of tissues. They were able to find out there is Vata, Pitta, and Kapha in your body without any modern equipment. Even the atoms, everything they have explained in this system. So that they were able to see because of the presence of the ojas and the other yoga and meditation activities which they were following religiously in their life. So that is something we are missing nowadays, and there is a big gap between the knowledge which they have shared one time and now what we have. Now we are just looking into the 7 dhadus because all these dhadus will function normally when that also the body is absorbing it in the normal level. If it increases, it can create problem. If it is decreased, it can create problem. So dyspepsia, salivation, heaviness, anything which is related with an indigestion, that is happening when the rasa dhatu increases. And the nutrients, when the body is not getting, all sort of weakness and other difficulties you can find when the rasa dhatu is not formed properly. The same way in the rakta dhatu or blood also, if it is increased, means all sort of inflammatory changes you can see in the body, where all sort of, again, it is related with the weakness only, the dryness of the body, the laxity of the blood vessels, sour taste. You feel that you have a little bit feverishness like things, so that can also happen when the blood is not sufficient. Then the mamsa dhatu, anything which increases the body structure, the body weight, we can see the goiter, the lumps, then the deposits in your abdominal region, thighs and all, when the mamsa dhatu is formed more, and when it is decreased, the muscle wasting and leanness of the body happen. The same thing happens when the fat tissues also increased or decreased in the body. And when the bones, if it is increased, means you can see extra teeth and extra ossification in the bone. And if it is decreased, means you can see the osteoporosis like things, shooting pain, then falling of hair, even the decaying of the teeth, etc. happens because of the improper formation of the bone tissues. Bone marrow also, the heaviness in the eyes, because you are not getting proper nutrition, the blood cell formation, everything related with this. So all sort of things you can find in this also when it is increased and when it is decreased. Then when it comes with the sperm or ovum, the increased sexual desire, then the prostate calculi, etc. happens when it is increased. When it is decreased, even you can find blood during the ejaculation, then the testicular pain, burning sensation, etc. can happen. And when we say about the excretory waste, we have three excretory waste: feces, urine, and sweat. This also has roles when it is increased and decreased in the body. So it should be eliminated in the normal way for a healthy life. So when it is accumulated or when it has already eliminated more than the expected quantity, that can create problem in the body. I'm just skipping these slides. Now we have three doshas, Vata, Pitta, and Kapha, and these three doshas have some relation with these 7 types of tissues and 3 types of excretory waste. Vata is the seat of Vata is in the bone, that is in the Asti Dhatu, and the seat of Pitta is both in blood and sweat, and rest of the dhadus, 5 dhadus and 3 mala, the 2 mala, 3 excretory waste, are the seat for Kapha. So these things which we have to keep in mind when we get a patient. We have to see what the dosha in that particular person, which dhatu has affected, and how the excretory waste are eliminating from the body. Because when it is accumulated, that is helping to generate toxins in the body. So that is the basic thing which we have to do when we get a patient. Then there are different causes for diseases also. One thing is due to the improper seasons, like when there should be proper heat or cold or rain in according to the winter, summer, or rainy season. If the normal heat is comparatively less, or if it is more, if some other seasonal effect comes, then that can create that is a supporting situation for developing a disease. Hina means something low, mithya means something improper, ati means something more. So that should not happen during the seasonal changes. Then sensory perceptions also, when you look into some very bright light, that's not good for your eyes. If you do something in a very low light, that's also not good. And mithya is something looking directly on the eclipse and all, that is also not good. So these things you can see with the other sensory organs also. So that is one reason for generating a disease. And if you use everything properly, that is the samyak yoga, that is good for arogya or health. Then the karma is the physical and mental activities. If you do physical exertion more, that is unhealthy. If you don't do anything, that is also create problem. And if you do something improperly, you can see so many people do different things with inappropriate parts of your body. So that things is pulling something with your hair, with your teeth, or lifting something improperly. All these things is, if you practice this continuously, that can create some problem in the body. For some people, rarely that may not cause this thing, but when we talk about something, we talk generally. So that is why those things we have to be careful. Then this kala, here we explain about the season. Then another column in Ayurveda is the time. Time means we have seconds. Then it is like kshanam, vinadika, dadika, muhurtam, yamam, divasam, masam, etc. It is explained about the time. And for a disease also, there is a time for that. In the beginning, it is one stage. Then after some time, when the inflammatory change or something, it's another stage. Then after that, it's another stage. So we have to understand in which state that particular disease is when the patient comes to us. So that time kala is also important along with the seasonal column. These are all some pictures. I'm just showing you what seasons are the improper or the over effect of different seasons. Then artha means the sensory exposure to different things, just like listening to high volume of sounds, or looking into something continuously for longer time, or eating different things which are not advisable for a healthy life. So these things are another this thing which can which is a cause for developing a disease. Then the karma is our mental, physical activities that can create problems. So these are the something things which we are doing now, like deforestation, pollution, and other things. Then the physical and mental activities also has a role in developing a disease. So mainly these three things are mentioned as the causative factors of developing a disease. And one more classification is, one thing is nija, that is the endogenous. Then if some external injury happens, that can also cause some issues. So it can lead to serious issues or minor issues. So usually when a disease develops, these stages the body has to come across, because we told you the seasonal changes, our sensory exposures and activities are the main reasons for developing a disease. So if we use these things improperly, or if you are exposed to these things which is not in a suitable way, then that is one reason for causing the disease. And because of that, there will be a derangement in the combination of the Pancha Mahabhuta. When there is a derangement in the Pancha Mahabhuta, that causes imbalance in the three doshas, Vata, Pitta, and Kapha. And when the tridosha got imbalanced, that will act upon any of the tissues and try to develop some issues there to manifest a disease. So wherever there is a disease, first we have to find out what will be the reason for that. When we come to aharam or food, we will explain what how much it is important in treating a disease. Because when a disease is manifested, we handle it with three things: with proper food, proper rest or exercise, and medicine. So now I'll explain the food, where even how much important it is in treating a disease. Usually the food, everybody knows that the complexion, memory, longevity, happiness, nourishment, everything is related with a healthy food, not with unhealthy food. And Ayurveda says, Rogaha sarvepi mandagno. The poor digestion is the reason for all the diseases. Why? I have explained how each tissues are developing with the help of each tissue digestive fire. Rasa Agni, Rakta Agni, like that. So when you take a food, first nourishes the Rasa Dhatu, the first day, then it nourishes the blood, then the flesh, then fat, bone, bone marrow, and reproductive. When there is an indigestion, then the nutrients will not reach to develop the proper healthy Rasa Dhatu. And if the Rasa Dhatu is not properly nourished, then there won't be much nutrients to develop the Rakta Dhatu or the blood formation. So the proper digestion, if we can maintain, then all the cellular changes will happen properly, and that will develop a proper sperm or ovum. And again, the next level of digestion is happen there. That will give you maximum immunity. So if there is a problem in the digestion, that can create illness at any level. If it has happened at the Rakta Dhatu, it will be one time. If it is in the blood Rakta Dhatu, then there is something in that level. If it is related with Asthi, you can find the body degenerations and other issues. If it is related with Majja, then related with the bone marrow, the diseases can happen. If it is related with the flesh, then the muscular dystrophy like things is, if neurological problem related with the muscles, that can happen. And infertility like things is, impotency like things is, if this is not reaching into the Shukradhatu. So that is why in every disease, first and most important thing an Ayurveda physician do is correcting the digestion, because we have to make sure whatever we give as a medicine or a food should absorb into the body properly, then only it will work. That is one thing. And the next thing, the proper elimination of the waste products also should happen systematically, then only there will not be a chance for accumulating toxin in the body. That is the most important thing related with the food. Then regarding the number of food, Ayurveda explains only 2 meals a day. Pratar Sayam Manushyanama Channam. One is in the morning and one is in the evening. You are supposed to eat food when the sun is up, because you have a fire in your system to digest the food. So the heat in the earth or in our environment is in daytime. So when the sun is up, it will help for the digestive fire also to work properly. When the sun goes down, the moon comes up, then the digestive system will go down. But now, unfortunately, in most of the families, they will have a heavy food at night, because only at that time all the family members will come together. And that could be one of the main reasons for developing so many new diseases also. Breakfast, most of them will skip. Lunch, they may have something, but dinner will be the main food. So that should not be there in our daily practice. We should have a good breakfast, and it's not lunch by 2 o'clock or 3 o'clock. If you can one meal, that is the best thing. Before you go to sleep, whatever you have taken should digest completely. Then only your internal organs also will get complete rest. When you sleep at night, your heart, your digestive system, your brain, everything should get proper rest. Then only you will get up in the morning. You can get up as fresh in the early morning. Otherwise, if you have a very heavy meal, you will not be able to get up easily in the morning. So you should have early dinner. And otherwise, one more thing which we can dilute in this case, you can have a breakfast, lunch, and early dinner, very light early dinner, because most of us are tuned to 3 meals a day now, not more than that. And the another one is na antara bhojanam kuryar. You are not supposed to take anything in between 2 meals also, because once you take something, the body is digesting that, and during the digestion, if again you put something, then the whole digestive process will get upset. So the proper absorption of the nutrients will not be complete there, because that digestive process is disturbed. That should not happen. When you have a breakfast, after 4 or 5 hours, if you feel hungry, you have your lunch. Then again, in the evening, you can have your dinner before sunset. That also, it should be very light, because by the time you go to bed, it should digest properly. So this is the basic rule related with food. And this is something we recommend to the patients also. And what is the rule of intake? Take food when you feel hungry. That is the cardinal rule to take a food. Because if your body is capable of digesting something, surely you will feel hungry. If you don't feel hungry, understand there is some other problem in your body that has to be corrected with proper medication or diet. Then take the right quantity of the food. What is the right quantity? When you take food, the solid food should be half of your stomach. Quarter portion should be the liquid, and another quarter portion we have to leave empty. If you grind something in a mixie or grinder, usually we will put half of that with solid thing, then we will put some water, and the rest of the thing we will keep empty. Then only you will get a fine paste. If you fill the whole thing with the solid thing, means the machine will not work. The same way in our body also, we are supposed to have only half of the stomach with solid food. That also you have to chew with. There is a saying that you have to
eat liquid and you have to chew liquid and you have to drink solid, because when you eat something, you have to chew well and you have to take it in a liquid form. That form is more easy for your system to absorb and to transform into the next level of digestion. And when you drink water also, sip by sip, you have to take that. It should mix up with the saliva properly when it goes inside. So that is another most important thing which we have to follow while taking the food. Then there are few items Ayurveda explains to take on a daily basis, like the unpolished rice, wheat, gooseberry, grapes, snake gourd, green gum, ghee, honey, pomegranate, rock salt, triphala, ashgar. These are all the fruits and vegetables which are mainly available in India. And there are some more things which is explained, but it's difficult to present because I don't know in your country these things are available or not. It's mainly this have a medicinal property. So that is why I have avoided those items. And many things we are not supposed to take on a daily basis, like the red rice also, when it is flattened or when you make it in a powder form, then the quality of that particular thing changes. And Ayurveda recommends not to have food prepared with flour or which is with batter on a daily basis, because Ayurveda says it's hard to digest. And any root vegetables, then nuts and all, you are not supposed to take on a daily basis. Even leafy vegetables you should not have on a daily basis. Non-vegetarian items you should not have on a daily basis, because all these food items are heavy to digest, especially in our climate. But in cold weather, Ayurveda recommends to have non-vegetarian, because your body is protected with the cold weather. So your body heat is preserved inside. So usually you will have more appetite. So that has to be compensated with some heavy food. There you can have deep fried items or these nuts or non-vegetarian items. Otherwise, in hot season and all, when you have more perspiration, you should have more liquid food. You should have food which is mixed up with sugarcane juice or even sugar, something which will help to maintain your sodium and potassium level and your glucose level also. And in rainy season, when you have food, it should be hot and liquid form, because in the beginning of the rainy season, your digestive system will be very weak, because the rain comes in India immediately after summer. So in summer, because of the perspiration, already your digestion is very weak. You don't feel to eat any heavy things, and you are entering into the next season. So again, because of the seasonal change, your body will again become weak. So there, because of the contamination of the water and all, you should have only boiled water and liquid food which is easy to digest to avoid communicable diseases and all in that season. Then the next thing is, I explained about managing a disease with proper food, then viharam and drug. Now it comes, the viharam means the physical and mental activities. In certain things you have to take complete rest. In certain diseases, in certain things you should do certain exercises which is recommended for that particular condition. And good conduct is how you have to behave with the society, because how you have to help people, how you have to interact with people, how you should show your love and empathy to the people who actually needed some help. So those things are explained in that. That also has a role in curing a disease. Then comes the drugs. Drugs we have in three groups. One is the specifying things, mainly the recommendation which is suitable as a diet for a particular condition, and the drugs which is helpful to cure those things. And the next one is the things which can aggravate. Even when you use a herb in a improper way, that can also aggravate a condition. And when you eat food which is not suitable for that a particular disease, that can also create more issues. Like if you have a cold, you should not have any cold items. You should not have any fried items. And if you have already a degenerative phase in your body, you should not go for heavy exercises. So these are some simple things which we have to keep in mind in relation with the viharam and the drugs. Then the swasthahita means the suitable food, which I have already given you a list of items which you have to, which you can take on a daily basis. So that is the pathyam, or the healthy food to maintain your body fitness. Now, regarding the disease, there is the two things which we have to. The psychosomatic disease, usually we will say one is in the mind and the other one is in your body. And in the mind also, we have three types of three gunas, we call it sattvam, rajas, and tamas. Sattva is something is good for your mind, where rajas and tamas are two things which can create more mental issues. So, but for treating these things also, I'm going to tell you that also in a very concise way. When we examine a patient, three things which we have to do there. The first thing is seeing the patient. When a patient enters into your consultation room, look how he enters into the body. You can see the physique of the body, the attitude of the person, and if there is some deformity, even when while walking, you can see. So that is one way. Then the next one is by touching the patient, percussion, auscultation, those things which we can do. Then the third one is by asking. In touching, even the pulse diagnosis is also included. Asking means we have to ask different things. So many things which we have to ask. That also coming in the next slides. Then how we have to understand a disease. First, we have to see what will be the cause. You have to ask the patient in detail how this has developed to find out the cause. And could you find some premonitory symptom? Because if issues are in a very early stage, or it has already developed into a particular disease. So that is the premonitory symptom and the symptom. And you have to see what actually gives some relief for that particular issue. They said, if I expose to some hot things, I'm getting better. If I foment the painful area, I am getting better. Or if I apply heat, the condition is getting worsening. So this will give some hints to understand which dosha is aggravated there. Then samprapti is from all this information, you have to develop how the whole thing has reached into a disease. So that is the samprapti. So after getting a samprapti, you can again plan how the treatment should be, stage-wise treatment should be. So this is how we will examine a patient and we will understand a disease. Now, how we will interact with the patient? What are all the things which we have to consider when we deal a case? This is something which makes a difference in deciding the treatment, because sometimes two patients will come with the same diagnosis. They may say that they have rheumatoid arthritis, and that diagnosis may have done after undergoing so many investigations. But for us, we have to see whether that particular person having these issues because of a vata vitiation or pitta vitiation or kapha vitiation, or where that particular this thing has developed, whether it is in the very early stage or it has already affected the bone tissues to make some deformities. So here, all these things which we have to consider to decide that particular person, because our treatment is for the patient, not for the disease. We are treating the patient. So that is why we have to consider his digestion, his age, his sex, all these things we have to consider. Now we will just have a look on everything. Age is something very important. Everybody knows that. The dosage of the medicine will be different for a child, for a younger person, and an old patient. And age is another thing for the mental maturity. Sex is another thing which we have to consider, because females, we have to look for their monthly period and other issues. Then the occupation, there are so many occupational health issues nowadays. So that we have to see whether that has some role in that, especially people working in some industries, in textiles, related with some other manufacturing areas. Then they will have different issues related with that. So either we have to tell them you have to change your job, or you have to move from that particular area. So those things is also have a major role in the treatment. Then the living surrounding. Surrounding means whether it is a marshy area or it's a very dry area, because there are certain things, especially in the Middle East and all, you can see more of this arthritic problem. You can see more of the stroke cases there. But in cold climate areas, you can find more of the skin diseases. Then there are also certain arthritis problems you can find more. So that is something which we have to, which is important to know about where that particular person lives. Then is there a family history? Because already there is a genetical factor, then you have to be more careful. And at least you have to inform the bystander, the family member, the difficulty in treating that particular disease. Then the food habit, because certain food habits, already the patient will be having an issue. And without his knowledge, he will be following some food habit, which will trigger his problem. So those things which we have to understand in that case. Otherwise, there are certain food habits that can create, that can help to develop a particular condition also. So that we have to find out whether that particular food habit has some role in developing a particular disease. Then the digestive capacity, I have already told you what happens if the digestion is not proper. Then the physical strength of the patient. Physical strength means if you plan to do certain therapies, for example, if we plan to do some Panchakarma therapy, if the patient is physically a little bit strong, then we cannot perform that. And the physical fitness is also very important in administering the internal medicine also. Then the mental power. If the patient is very positive, it is more easy to treat even more complicated cases. In some patients, in some ages also, certain treatments are not recommended. But if the patient is mentally very strong, then we were able to perform those treatments. But even for a younger guy, if he is mentally very weak, even the treatment which we are supposed to give, we may not be able to give. So that is very important in deciding a treatment protocol. Then we have to see the severity of the disease also, because certain patients, even if they have a very simple issue, they will express it like a major issue. So that we have to understand what is the severity of the disease, because according to only we need to plan for the treatment. We may have to recommend some simple diet and medicines to correct that problem. Then is there any relation with the season? That we have to see, because certain things they will say, yeah, in winter it is getting aggravated, or in summer it is getting aggravated. So that can be correlated with the doshas we can. So we can understand this dosha is getting aggravated due to this season. So that is the reason for developing the disease. So that is also giving us a clue in deciding a treatment protocol. Then the specifying factor, already we have discussed what are all the things which give some relief for the issues. Then do they have any bad habit? Then the body constituency, that by birth, each person will have a body constituency. For example, before I told you what is Vata dosha, what is Pitta dosha, and what is Kapha dosha. And this is another one, is the Prakriti, means that is your body nature. If you are lean, if your skin is very dry, if you always change your decision, and if you have a very dry eye, if you have a constipation, these things are for a Vata Prakriti person. And for a Pitta Prakriti person, usually they will get early graying of the hair, they will get early baldness, and they will be over sweating, they will be very short tempered, they cannot tolerate hot weather, and they like to have more sweets and cold items. So that is the nature of a Pitta Prakriti. And when it comes to a Kapha Prakriti person, a Kapha Prakriti person will be a well-built guy who will have a very strong body, and his mental state also will be very strong. He will decide things after thinking that particular thing properly. So these things are very important, that understanding the body constituency of person is important in deciding treatment. For example, if the Vata is vitiated already in a Vata body constituency person, then the treatment is going to be more difficult. And that too, if it happens in a rainy season, then again it is more difficult, because in rainy season the Vata is again aggravating. So these things has importance in deciding a treatment. Then the imbalanced vital forces, whether the Vata or Pitta or Kapha has aggravated, then the affected tissue, this aggravated Vata, Pitta, Kapha, where it has accumulated to develop a disease, and how the excretory functions in that particular person. So this much things which we have to consider to decide a treatment. So this will be different from person to person, even if they come with the same complaint. So understanding a person in deep, taking a well-detailed case study is very important to give a proper treatment, a treatment that includes internal medicine, sometimes some therapy, diet, rest, or exercise. Now, regarding the treatment, we have two types of treatment. One is, we call it is Shodhana Chikitsa. Shodhana Chikitsa is the Panchakarma Chikitsa. Samana Chikitsa is usually if it is in the early stage, very early stage, and the vitiated doshas are accumulated either in the first two tissues, then the Samana Chikitsa is helpful in that. If it goes into the deeper tissues like fat tissues, bone marrow and all, there we have to go for deeper cleansing where Panchakarma is needed. And for these three doshas, there are particular Panchakarmas recommended. For Vata, I told you the seat of Vata is below the navel, that is the large intestine, and the easiest way to administer medicine to that area is through the anal canal. So that is why Vasti is the main treatment, and the main medium to do Vasti is oil. Then the next one is Virechanam for Pitta. Pitta, the seat is in between the heart and navel. There, ghee is the most effective medium, and Virechanam, the purgation, is the treatment there. Then for Kapha, I already told you, the induced vomiting is the treatment for Kapha, because the seat is in and above the stomach. And for pacifying Kapha, honey is one of the main ingredients. And for mental diseases, Dhi, Dhairya, Atmadi, Vijnanam, that is means whatever is helpful to strengthen the mind and intellect, that can be administered there. That can be done with medication, with Panchakarma, Shirodhara and other things. And sometimes little bit spiritual side also we have to incorporate during the treatment. And in mental disease also, usually there is relationship with the body to develop a mental disease. So first thing, in a mental disease also, we will do according to the dosha vitiation, whether it is due to Kapha or Pitta or Vata, we will plan Panchakarma. So first we have to do Snehapanam. We will give either oil or ghee in large quantities to feed each and every cell in that medicine. And then we will give fermentation to liquefy the toxins and bring into the colon. Then we will decide either to eliminate through the mouth or anal canal as vamanam or purgation or vasti. This elimination of toxins will help to have more freshness in the mind, then we will go for Shirodhara and other internal medicines which can strengthen the mind. Just by giving some internal medicines alone, these mental issues cannot be corrected, because we get lot of depression cases, early Alzheimer's cases and all. So here, if the case is new and if the patient is young, then we will be able to do the therapy properly, because Snehapanam is something, the medicated oil or ghee which we give orally, and every day we will increase the dosage, and at one point the patient will not be able to have more quantity of this medicine, then there we will stop. And not only that, at that level you can see when they pass urine or motion, you can see this stains of this medicine in that. That means it has reached to the whole body, the all tissues in your body. And the next 3 days we are supposed to do oil massage and fermentation to liquefy the toxins, and automatically that will move to the colon, to your intestine. So according to the variation of the doshas, we have to decide if it is related with kapha, you have to perform emissary therapy, forceful vomiting you have to do. If it is related with pitta, you have to do forceful purgation. If it is with vata, you have to do enema. And after this cleansing only, you can do something for the brain rejuvenation. Otherwise, it will not work. And after doing this way of treatment, we are getting very positive results also in these types of cases. So the Shodhana and Samana Chikitsa has its importance according to the tissue is affected. The early stages, Samana is sufficient, but if it is more deep rooted, then we have to focus on Shodhana. This I have already explained, what is Panchakarma, the emissary therapy to clean the upper GIT, then Virechana, that is for Pitta, to clean the middle GIT, Vasti, the medicated enema to clean the lower GIT. Nasya is the nasal administration of the drugs to clean in and above the neck region, and Raktamoksha is bloodletting to expel the impurities in the blood. Vamanam, usually we will recommend for respiratory disorders, those who have persistent cough, cold, asthma, and in certain skin diseases, recommend UTI, obesity, thyroid dysfunction, etc. In Panchakarma, this Vamanam is very important because the kapha variation is more in these cases. When it comes to Virechanam, wherever there is a pitta variation, we will plan for Virechanam. So the jaundice, abdominal pain means if it is related with the small intestine, then if there is an intestine parasite, then poisoning, in many skin diseases, insomnia, in these things we usually recommend Virechanam. Even in depression also, in certain conditions of the depression, psoriasis like skin issues, we will recommend Virechanam also, because that helps to purify the blood. Vasti is the medicated enema that usually in abdominal tumor, abdominal pain, diarrhea, infertility, urinary stone, gynecological diseases like PCOD, PCOS, then low back pain, stroke, facial paralysis, in certain conditions of muscular dystrophy, the neurological issues, all in issues, this medicated enemas are effective. Nasyam is the nasal administration of drugs in which we use medicated oils and the juice of certain herbs, certain powder, depends upon the condition we select that. So this is effective to strengthen all our most of the sensory organs, like the vision, hearing, then the smell, taste, and it's good for certain eye diseases, then toothache, headache, facial paralysis, trigeminal neuralgia like issues, insomnia. We recommend this Nasyam, and that we decide there are so many combinations to do Nasyam. So Depends upon the condition, we have to choose which nasayam we have to select for that particular condition. Raktamoksham is we are taking out a certain quantity of blood, either through puncturing the vein, just by taking out with the help of a syringe, or by putting leeches, because leeches, they suck the impure blood in the beginning. So in certain local area, if it is there, means we put leeches there, or in some other cases, we do it with creating a vacuum, that is stringum like things. We do in 3-way, we do the rectamotion. Mainly those blood impurities happen because of the vitiation of Pitta. And if like in certain rheumatological problem and in varicosity, if there is severe pain, and some patients, they will get bleeding during sleeping and all. So in that cases, bloodletting is very effective. And this we do in like some allergic skin rashes also, eczema, then acne, leukoderma, these things also we do. But those who have anemic and very weak, we are not supposed to perform bloodletting. Then there are 4 main things which is needed for a treatment. The first one is a physician. A physician, Dakshan means he should be very intelligent. Then Tirtha Artha Shastra means he should be learned the science properly. And Drishta Karma, he should have seen all the complications, and he should have a mental and physical purity. So these 4 qualities are explained for a person who wanted to be a physician. Then when you select a drug, it should have 4 qualities. One thing is, if you are taking a fruit, it should be properly ripened. And in some fruit, it should be in a, we should be use it in the tender form. And in some cases, we may take the root of a medicinal plant. Sometimes it will be a bark of a medical plant. So whatever raw material which we are using, that should be capable to make it in different forms, because we make medicated ghee, medicated oil, powder form, decoction. So it can be used to make different formulation, and it should have proper medicinal quality, and it should be collected in proper time, and there should not be any impurities in that. So if these 4 categories are fulfilled, that drug we are supposed to use. Then Upastada means the person who is attending the patient. He should be pure mentally and physically. He should be intelligent. He should be able to explain to the physician what he have seen while doing the therapy and all. And he should be a loveful personality, because always he should have that empathy towards the patient, because he should have always in his mind that he is dealing with a person who has a pain. So that is his responsibility to reduce that discomfort. So that should be the quality of an Upastada. Then the patient means he should be willing to arrange everything for the treatment. He should be ready to, he should be surrendered to the treatment. And he should follow whatever the physician is recommending. And he should be able to express properly what his problem is. And mentally, he should be very strong. If these qualities are there for a patient, and if all the 4 group of this thing, if all these 4 qualities are fulfilled, then we will get a proper result. And we cannot say that all the cases we will be able to cure. There are so many factors which has a role in curing a disease. If a person is very young and who is mentally very strong, and if his vital organs are not affected, and if a disease is not fully developed, and if he is able to arrange the whole 4 components to treat, and if it is not affected so many other systems, then that is something which we can treat very easily. If something which we have to manage with surgical equipment, then it is more difficult and complicated. And there is another stage where in certain cases we will not be able to do anything. So there we have to inform the relatives, this is the state, but still we will try if something can be done. So that way we have to deal it. So don't think that even if it is a herbal medicine, each and everything we will be able to handle successfully. No, we will go through all the details while taking a case history. There we will get a clear picture at what level this patient is going to benefit after undergoing the therapy. That if it can be communicated with the patient, we will do. Otherwise, whatever we are supposed to communicate with the bystander or the relative, that we have to inform there. Then so many other things are also explained to keep your body healthy. That is the daily regimen. I just explained few things related with that. When you have to get up, when you have to sleep, what type of food you have to take. There are so many things. There are so many other things are also explained in daily regimen. How you have to take bath. What is the benefit of applying oil every day? How much you have to do the exercise, those things. Then how you have to change your seasonal regimen. That also I just explained, that how it should be your diet in rainy season, what should be your diet in summer, and what should be your diet in winter. And regarding the exercise also, in summer season, you should not go for heavy exercises, but in winter you can do. In rainy season, you have to be careful without exposing to the rain and the dirty surrounding. You have to be careful in doing your exercises. And how you have to have your food, that also we just went through. Then there are certain things which we are not supposed to mix up and take. Hot and cold items we should not have. When you take hot food, it's not advisable to have a cool drink immediately after that. And if you have a meal, it's not advisable to have an ice cream at the end. And it's not recommended to have yogurt and chicken together. It's not recommended to have buttermilk and banana together. There are so many combinations which is explained in Ayurveda, which can create vitiation in the 3 doshas. And the good conduct I have already mentioned. Then this is what is Ayurveda define about disease. The manifestation, the perturbation of the equilibrium state of the body constituent, that is the doshas, the dhatus, and the malas, are creating a disease. A medicine which brings the doshas in an equilibrium state, which bring back to the normal functions of the tissues, and which correct the elimination of the toxins and correct the whole functions of the body, that is considered as the medicine. Even the food we can consider as a medicine, that we call it is the patyahara. Then this is the definition which is given in Ayurveda for health. Health is defined as a state where the dynamic balance of the doshas, Vata, Pitta, and Kapha, are maintained, and the 7 tissues are functioning in its optimum level. The excretory waste are expelled from the body properly. The metabolism is in the optimum level. The soul, mind, and sense organ assume the sublime position. That person we call a healthy person. So that's all about the presentation today. This is a sloka which explains how you can be healthy. Nityam hita ahara vihara sevi samikshakari vishayeshu asaktaha dada samaha satyaparaha kshamavan aptopasevi ta bhavatya roga. A person who have proper diet, the right quantity of food in right time, who do the right quantity of mental and physical exercises, who helps the needy people, who keeps his mind always relaxed, who have patience, then that particular guy will be always in a healthy state. Thank you all for listening this much time.
Thank you, Dr. Thrivikraman. It was so wonderful to hear the entire webinar today. It was so knowledgeable and you covered a lot. I'm so grateful for the entire presentation. It's amazing. There are some people who had questions who raised their hands. I don't see any right now. I had one question. Maybe I could go ahead until then. When people raise up their hands, I can pass it on to them. I had one question. You said about how there is different food for different climate, different seasons, and how in India we are supposed to eat in a certain way, and how in colder climates you can eat a little meat or something, like you said, that non-vegetarian Ayurveda does recommend to an extent. So I was just gonna ask a question on that because I'm a vegetarian and I live in a very cold climate. In fact, colder than this. I've lived in Winnipeg and been a vegetarian since my childhood. So I was going to ask this question, is that when Ayurveda, I am grateful that you actually said everything according to Ayurveda in an unbiased way and brought out the wisdom of Ayurveda. But when I think about the time of Ayurveda, then I think about that things were naturally obtained, unlike how they are unnaturally obtained today in factory farms, and how like even people, I'm not saying, I'm not trying to say that non-vegetarians should turn into vegetarians or anything. I would be happy to see people turn vegetarian in life, but I just wanted to see, like, you know, how still, like, is non-vegetarian food in today's society, where it comes from factory farms or from extreme cruel conditions, is it something that our Ayurvedic acharyas would have recommended? Because like you said, our acharyas spoke about sex on certain, you know, in a certain fashion, so that you don't go extreme flesh-based person, but you elevate and transcend. I also read a lot of our acharyas also had opinions on following a meatless diet, where they also spoke heavily about you know, like why you should not harm some other jiva. And today it's not even like natural, like they don't even live in natural forests, they live in cruel farms. So when it comes to our acharyas who wrote Ayurvedic text, I want to ask, like, would our acharyas at that time, according to what you feel, because they are not there anymore and they are not seeing the condition today, so according to what you feel, do you see they would have recommended people to eat these factory farmed meats that are not coming from a natural, because Ayurveda has a term jungala, and this is not jungle. I avoid factory farmed milk also. I get it from a small farm. But I'm just wondering, like, what is your opinion on what the sages who wrote these texts would have thought about this, the meat consumption today?
Actually, this is a very vast subject to discuss because I have to go in deep about the food. Ayurveda, yeah, mostly when we say about the items to take on a daily basis, their non-vegetarian is not recommended, or anything which is hard to digest is not recommended, because when we feel weak mentally or physically, the quality of work we are supposed to do
you may not be able to complete it properly. The same thing you can expect in your internal organs also. So continuously, when you put heavy things in your digestive system, that also will get tired and it will not function properly. So only partial absorption and digestion will happen there. So rest of the thing will be deposited. That can anything when you put somewhere after some time, when it start decaying, you can see how it will be there. The same thing you can expect in your system also. So that will cause like gas problem, acidity, constipation. That is the beginning of developing something. That is why I told you that roga sarvepi mandagno, everything is because of the improper digestion. So there, according to, and one more thing is there. Even if we recommend certain food also, you have to see whether that particular food item is suitable for you, because so many things, because you will be following a diet which is suitable for your region. For example, South Indians, we are used to take more rice and whatever vegetables which grow in our area, but wheat and potato like things, so usually North Indians will eat more. So when we eat potato and wheat more, we are getting constipation or severe gas problem. That is not happening for the people who are used to those food. And those who take this raw rice here, the North Indians, we are getting more problem with this. So that geographical importance is there for a diet. So usually we will have a traditional food habit. That is the most important thing. When we adopt something from some other place, we have to see whether it is suitable for your system or not. Because even that is important in preparing the medicines also. When you prepare medicines with the locally available herbs, that will be more effective for the people who live in that particular area. So the same thing, it is there for food, dress code, everything. Why Westerners are using three-piece shoe and all? Because of the weather there, it's more cold there. Why we use dhoti and simple shirt in Kerala? Because we have 6 months rain here. So sometimes you have to fold the dhoti and walk in rainy season. So that in Gulf countries, when you go, they use that white dress, that just hollow white dress, they use that because of the heat there. So that difference is there in every place. So that is something which we have to understand first. Accordingly, we have to adopt a diet. And when you eat something, if you feel some discomfort in your digestion, if you feel it is heavy, or if it creates some gas problem, or if it creates some abdominal pain or other discomfort, understand that that particular item has some issues with your system. So either you have to reduce the quantity of that particular item or you have to avoid that. So each item which you are using in cooking, each item wise you have to take. If you mix up so many things, you cannot make out which one is creating problem in you. And related with the season also, even if I say milk products, deep fried items are good to eat in winter season, don't follow that blindly. In winter season also, due to some other problem, you may have some digestion problem. So that part you have to be aware, and accordingly you have to choose what food is good for you. For example, if you have a cold, the cold in a winter season, you cannot go for deep fried items. You cannot go for milk product there because already there is an indigestion. So you may have to go for vegetable soup or something which is prepared with pepper, ginger, or some other spices. So that way we have to change our diet, where we have to apply our common sense basically. According to the situation, season, health condition, we have to change our diet. See, whatever you take, the body will tell you whether it is suitable for you or not. Only you have to be more careful about the quantity and timing and the way of intake also. Don't be in a hurry when you take food also. Don't talk when you eat food. Don't watch TV when you eat food. You have to apply all your sensory perception into that. You have to see the food. You have to touch the food. You have to taste it. You have to smell it. Then only the maximum digestive juice also will come out to digest that particular food. If you look at something else and eat, just like putting in some dustbin, this will be going inside, and then you cannot make out what is the half portion of your stomach. But when you meditate in your food and eat, after a week time, you can understand this is my right quantity. For example, if you take paneer, this much quantity is sufficient for me. If you take soup, a little bit more quantity you can have. So depends upon the heaviness, we can say. Something is very easy to digest, something will be hard to digest. So depends upon that, you have to again make changes in the quantity. It is not just grams or ounces. It is depends upon the quality of the material which you are taking. So that way we have to change it.
That answers part of my question about the seasonal aspect. But when you think about what our acharyas would have thought about the way meat is produced today and how it is coming from in extreme case of inhuman factory farm and unhygienic conditions with injections and with so much fear. So
no, that I have already explained, because acharyas never recommended to have non-vegetarian on a daily basis. But acharyas explained, if there is a muscle wasting, then the best thing to compensate that is the flesh of an animal. And goat is something which is more suitable for your body, for a human being to adopt. That is why if there is no breast milk for a mother, the goat's milk is recommended. If there is a brain degeneration, the goat's brain supposed to make a soup and give in that form. If there is a problem in your spine, the goat's spine is recommended to prepare a medicine. The goat's flesh is recommended to make a medicine if there is a muscular dystrophy. So that is recommended as a medicine in a particular condition. Otherwise, I don't think they have supported taking non-vegetarian, but in certain conditions you can use that as per the requirement. But now we focus more on the taste, color, flavor and all, and we are more exposed to have, or more interested to have more unhealthy food.
today
That
meat
is
is
happening
not
everywhere.
Today, meat is not medicine. Today, it is like, yeah, they use maybe some cow serum and vaccine, but today, meat that people eat is not medicine. It is not it is not prepared in the Ayurvedic medicinal form also.
That is the industry, something different.
So it's inhumane. But just how you said, our acharya spoke about sex, which I highly revere, that they have given us so much knowledge, even for grihastha, for a householder. So I have also read about acharya speaking about not killing. Like when you give harm to an animal, tie it. And I was reading that even tying it or capturing it is actually is ahimsa. That someone wrote it who wrote on Ayurveda, and they said that meat of such an animal will actually harm a person's subconscious mind, where the animal was tied in fear or kept like that. So I feel that the jangala concept of Ayurveda, which was forest or something natural, is not it was probably something more different than what today the fear concept. Like, I think a lot of people have a lot of inbuilt fear today inside them. And I think that that is also coming a lot from the society we are living in.
Not only killing, even that thought should not be there. That's what Acharya said.
Yeah, but it is all coming from the fact that where you have mass killing of chickens that are living in fear, like you keep them closed in locks and they know they're gonna die. And that's a fear, continuous fear we are building in them. Then like, I feel that a lot of that energy gets transferred. Some of our, like, I feel that a lot that we invest in it, we are all getting that conscious energy inside us somewhere or the other of them.
Yeah, in food also there is satvika, rajasa, and tamasika food. So non-vegetarian we cannot consider as a satvika food. It is a rajasika food that will make your mind more arrogant. So that is why even now people started consuming these types of food. You can see the cruelty and the criminal people in the society is also increasing everywhere. That was not the situation even in India. Here now, in my childhood and all, if somebody kills somebody, if there is a murder, we feel so sad. But now daily, at least 10 murders will be there. Even the children are killing their mother. That is the state now. So all these intoxicating items have a major role. It's not just food. Everything you can see, the narcotic items are also plays a major role now. But the main reason for this is somebody is there in making money or their comfort by selling or marketing these products. That is why Ayurveda, there is a chapter, Janapato Dhvamsaniyam. The communicable disease is happening mainly because of the rulers. If the rulers are not strong enough to implement the good things in that particular country, these types of things, even the disease can spread like anything in that particular place. So the same way now, how many people are concerned about using organic items and a healthy way of food? They know everything. Even if you try to arrange a program for a healthy way of cooking or a free yoga class for a group, the number of participants are very less in that, because people are becoming less interested in these things. They wanted to enjoy the life. That is the thing. But at least if you are ready, then with that, we have to go further. That is the situation now.
It's perfect. Amrita has a question.
Please.
Thank you so much. That was lovely and very, very comprehensive and informative. A lot of information. One of the things that I really appreciated you saying is that the root of all disease is digestion. And that is really, really important, because I feel it's physical digestion and psychological digestion, both go hand in hand. I think that was really an eye opener again and again for me, you know, that digestion and how to eat, to acknowledge the food as sacred. And secondly, I thought, you know, I've been a vegetarian. Okay. And I follow I have an Ayurvedic doctor and I follow all that. But I tend not to judge non-vegetarians, because there are so many indigenous knowledge that we don't know about, how things are done. We're talking about industry versus indigenous knowledge of people who actually consumed meat out of necessity. So the industry is quite cruel, for sure. But then there's a whole population of millions of indigenous people who follow a certain way of life. So I think when I talk about these things, it's good for me to be a vegetarian and just follow the path I'm in. And I think that energy itself, rather than fighting it, and will multiply and radiate and, you know, be very influential on other people, because it's really hard to judge these days, these controversial topics. I have a lot of indigenous friends and students from here, and they would disagree with a lot of the conversation. So because it's not black and white, there's so many things depending on it. So coming back to digestion, what is the best way to know that whether you have digested food or not?
Yeah, usually after a meal, if you feel hungry after 4 or 5 hours, then you can understand what you have taken in the previous meal has digested completely. And when you pass motion also, there is specific criteria explain how the fecal matter should be. If you have a good digestion, the fecal matter will be formed. It will be in a correct shape. There will not be any undigested food particles in that, and that will float on the water. If it sinks in the water, means it is still heavy. Some undigested food items are there still. Nowadays, when you ask your patients, 99% of the patient will say that the fecal matter will sink on the bottom. So that is now the most of the issue is because of the unhealthy food and overeating. If it is not with an accident, most of the problem is because of the overeating and unhealthy way of eating. And you cannot find not even a single person without gas problem.
Right. I've been a vegetarian for 25 years now, and I find digesting beans and chickpea and all that is hard. Is there something like ginger or something else that we can add to digest it properly?
You can add. But the thing is, first you have to see what type of food is difficult for your system to digest. Even moong dal, usually we will recommend the green gram. But if somebody is having indigestion, even that moong dal can cause constipation. That can create gas problem. Ayurveda recommends to eat moong dal on a daily basis. But you have to see the condition there. Even if there is a fever, Ayurveda says the basic cause for a fever starts with the digestive problem. So in the initial stage, Ayurveda never recommends to take a medicine there. The person has to take fasting, because whatever undigested items are there, that has to be digested naturally. If still it's not digesting, you can start drinking little bit warm water. Again, there is problem. You can put dry ginger powder or something. You can boil it, not in a thick decoction. It should be a drinking water like thing that you have to take frequently. And once you feel appetite, once you feel that hunger to have some food, then you can start with some rice soup. That also medicated rice soup with pepper, ginger, cardamom or something. And again, the digestive fire increases, then only the medicine is recommended there. Otherwise, even if the medicine will not digest, if there is a severe indigestion. So that much importance is there in correcting the digestive system.
Thank you very much. I really appreciate you taking the time and presenting. And thank you, Gauri, for organizing this.
Thank you. And can she not add like asafoetida and like cumin? Will that not, asafoetida, will it not help in digestion for moong dal?
Depends. Actually, you have to have warm water when you take moong dal. After that. So, because again, you can see for some people, they cannot have pepper. Some people, they cannot have ginger. So that also you have to consider.
So it's person to person. But warm water after food, instead of drinking cold water, it is more advisable to have warm water for better digestion.
Yeah. Yeah, warm water is recommended.
Okay. Anyone else has a question? Believe nobody else has a question. I think Eliza before had raised her hand, but I'm not sure if they still have a question anymore. But I guess nobody has a question. I think your presentation was so elaborate and so comprehensive that like people learned a lot. This is probably I would be watching it again. It was a very detailed presentation. And we all learned quite a bit, especially about the fact that how Ayurveda is very much based on digestion, and how we have to see how well we are digesting something and how we have to start small with little
In this,
baby steps.
each heading, there is so many things as to talk. So the whole thing I tried to give in a nutshell now.
Yeah, but it was still very comprehensive, very, very detailed. Like people didn't have so many questions. That's like there was a lot that you explained through the presentation, which was amazing. So that's really, really nice. And I think like I learned quite a bit. Now I know, that I have to. And for water, we should wait a little bit after food to drink water, or can we drink right away?
Pardon, in between, I was just looking into one of the chat box. Sorry.
With food, after our food, should we drink water right away, warm water, or should we wait a little bit?
Yeah, you have to wait some time. At least, if possible, after an hour.
An hour, and then drink warm water.
Yeah.
Okay. Sometimes it's very hard.
Only in extreme summer, you can have room temperature water. Normal water, not refrigerated one.
Not refrigerated, but like in summer you can have the cold water, not refrigerated, but you can put it in a mud pot
and have it.
You can put it in a mud pot. It's a natural agent.
That you can.
So I think
you mention where you are situated, the name of your place or organization, please?
Pardon?
Swetranya Ayurvedasram.
Swetranya Ayurvedasram. This is in Kerala.
I was planning to send the video. I can share it in the meetup group. I do have the YouTube link here also. Let me see. YouTube. Okay. Okay, I am sharing his YouTube link for his hospital with all of you. So on the chat, so you guys can check. So his hospital is literally it's literally an ashram. It's like a spiritual abode. Like you go there and you will feel probably rejuvenated. I haven't been there, but like just the whole look of it is very relaxing, very rejuvenating. It's like you're not just going there for like, you don't feel like you're in a hospital, like I've heard so many doctors say, even one of the Ayurvedic doctors on my show, I've heard her say that, people here, they probably, suffer from even hospital food. So just imagine, like an allopathic treatment. So just imagine when you look at his video that, what type of hospital it would be, that, you're getting the purest food, purest water, purest atmosphere, like the fragrance of the place is in itself, so fresh for your mind. He himself is a vegetarian doctor. So it's a vegetarian, like it's a pure ashram. So it's very beautiful. So I think like we don't have, it don't seem like people have many questions. So I hope that you can join us again, Dr. Thrivikraman, for a webinar. And
We will
maybe,
see.
maybe you can share a little more about the Panch Vayus that you said that you couldn't go through today.
Yeah.
In a
We
future
can,
webinar.
we can take another small portion and talk on that. That will be better. If
Yes.
required.
It will be a good learning experience for all of us. There are people, they look interested. They like, you know, a few small proportion of people want to join something serious like Ayurveda, yoga, and the ancient proper knowledge of it. But it's good to see that, you know, there are people who are still interested in this wisdom. And it's very healing and it's very calming, and it's very good for our overall well-being, not just body but soul and mind. So thank you so much, Dr. Thrivikraman.
Thank you very much for organizing this.
Hope to have you again.
It's midnight here, so that's why I said good night.
Yes, good night to you, and
Thank you.
thank
Good
you.
night. Thank you, Gauri. Thank you, Doctor.
Thank you everyone for coming in. Okay, thank you. Thanks, Eliza. Thank you. Bye. Please leave.
Okay, then. Bye.
Bye.